Hello everyone, this is Dr. Ryan House with Cumberland Chiropractic and Sports Medicine. So trying to figure out what to do video-wise today. I've had a lot of patients lately that have had a common problem with a multitude of symptoms. I've had runners that get what we call a stitch in their side. Certain point during their run, they get this cramp. I've had some people that have had back pain, and I tell them, hey, did you see how crooked you are? Like there's something in here. I've had people that have had a kind of a cramping, pinching pain when they take a deep breath. All these had a common denominator, and that's a nerve entrapment. If any of those sound remotely like you, stick around. So we're talking about a problem in this area. First thing as a physician, we've got to ask, what lives there? I'm going to show you some anatomy details that will help you understand. So a couple of quick anatomy details. Here's the side of our anatomy model. Let's zoom into this flank here. There are multiple layers of abdominal muscles. You got external oblique that we can see here, internal oblique, transverse abdominis, multiple layers that form the surrounding of our core. Now, there's a specific nerve that we need to know about in order to talk about this stitch. One, T12 subcostal. It pierces through the abdominal layers that we just talked about, attaches onto what I'll call a trunk of a nerve, and then goes all the way to the spine. So why in the world would this spot that we just talked about on that anatomy picture be a common problem? Okay, just for example, if you were to stick your fingers in your guts, not on your pelvis or your ribs, but in your guts, and you were to walk, every step you take, you're going to feel contraction, contraction, tensing, one side, the other side. The amount of steps you would take in a lifetime just says there's a lot of demand for the area, okay? If something goes wrong, you got a poor pattern, an old injury, something just goes haywire in that area, that can start a process of forming micro amounts, or macro in the case of a big trauma, amounts of scar tissue. We call that adhesion, I call it Velcro, meaning that nerve might get stuck to those layers of abdominals. So you got that problem, okay? It happened to you. You walk in our office and say, man, this might be the symptoms you feel. Every time I run, I get a stitch, a cramp in my side. I don't know why I keep getting that. It loosens up if I can really take my time and get it stretched out. One example. Number two, you walk in with back pain, and I say, did you have any idea that you're standing like this, like there's something clamped on this side? Things are tensing up to protect. Okay, that could be you. Every time you take a deep breath in, if you got like a shocking, pinching kind of a pain around this zone, that could be you. Those are common examples and some of those familiar ones I've seen a lot lately. So we've got the symptoms, we've got the problem, we've got the subtle idea you got something going on. You come into our office. How in the world do we find it and fix it? That's the solution here. First of all, we've got to find a motion, position, that kind of makes you subtly or blatantly feel this tension that you've got, okay? So we find that motion and you're like, man, every time I do that, and we feel, because we've been doing this a long time and we've really trained our hands to be sensitive, we feel that interface between muscle and nerve tense up all at once. Our job then is to find where the Velcro, the adhesion between muscle and nerve, lives, to put our fingers kind of literally between that nerve and its stuck spot, in between the layers of Velcro, and have your motion and our fingers peel apart that Velcro. We get that peeled apart, you say, man, there is something kind of amazingly different about that area now. We did our job. We do that job a few more times in a row because that Velcro wants to grab back, but a few more times in a row and we get weak Velcro. We get weak Velcro, you're free of your problem. If this sounds like you at all, we would love to help you. If you like this video, give it a thumbs up, share it with your buddies, comment down below if you got a question. This has been Dr. Ryan House with Cumberland Chiropractic and Sports Medicine, where we get you better faster.